Good afternoon. My name is Tomokazu Kishiki. I'm working at the North Shore University Health System, Evanston, Illinois. Today, I am going to present teaching pre-oral endoscopic myotomy to surgeons, an intensive hands-on pre-test curriculum. I'd like to thank the Society for allowing us to present our work. We have nothing to disclose. POEM is a new surgical procedure used primarily to treat agalacia. Historically, the standard approach to teaching new surgical techniques was a balanced mixture of hands-on exercise following lecture-style instruction. However, participants come to the course with different skill levels. Conducting hands-on practice at the beginning of the course allowed learners and instructors to focus on knowledge skill gaps and engage in targeted learning during the course. We hypothesize that hands-on lecture, hands-on course style will increase recalled knowledge and the ability to perform new procedure more than courses that heavily emphasize lecture-based instruction. We expected high level of participant satisfaction with the new style. We conducted hands-on training before and after the lecture-based portion of the course and gave short written tests at the beginning and end of the course. We evaluated POEM competence on both ex vivo and in vivo posing models. 6 POEM courses were taught by 11 experienced POEM endosurgeons at 2 independent simulation laboratories. At the beginning of the course, training completed a knowledge-based quiz and hands-on pre-training test using explant models. Next, participants attended lecture about patient selection, technique, and troubleshooting. Following the lecture, hands-on training with an experienced mentor was performed in vivo on live posing models. The last portion of the course consists of the hands-on post-training test using explant models and knowledge-based quiz and feedback survey. For the ex vivo models, posing esophagus and stomach are removed as one unit. For in vivo models, pigs are placed under general anesthesia in the supine position and the procedure was performed. We assessed POEM performance with a Likert style scale, measuring equipment setup, access for mucosotomy, endoscope navigation and orientation, visualization and stabilization, myotomy and closure. This is the statistical analysis. A total of 65 participants took courses between 2012 and 2016. Participants with varied degrees of experience in upper GI endoscopy and laparoscopic agalacia cases completed the course. Hands-on pre to post POEM performance increased from 15.1 to 12.25. Participants improved their knowledge quiz scores from 69.7% on the pretest to 87.7% on the post-test. Participants were grouped by experience with upper GI endoscopy procedures. 18 novices had performed fewer than 100 cases. 47 experts had performed more than 100 cases. Novices have less experience with upper GI endoscopy, lower GI endoscopy, and laparoscopic procedure in general. Novice has significantly lower pretest score compared to expert. Both groups improved significantly after the course, and there were no differences in post-test score between novices and expert. Both groups exhibit a similar pre to post trend. Course evaluation were very high. Over 90% of the participants rated the course as very good or excellent. 55% of the participants responded to the survey. 46% of the participants performed an average of 5.5 procedures per year after the course. 28% of participants are planning first procedure next year. Our training system was composed of hands-on pre-training tests, lecture and discussion, hands-on mentoring session, and hands-on post-training test. The hands-on pre-test was performed for baseline assessment, which helped instructor recognize area of weakness and provided informative feedback. Trainees are able to focus on area of the procedure they see as weakness from the pre-test assessment. Lecture and discussion allowed for Q&A to direct teaching toward difficult aspects of the procedure. The expert instructor is able to observe and correct mistakes effectively with in vivo posing model session. Greater emphasis on hands-on training rather than lecture-based learning is an effective way to teach new surgical procedures and may have allowed participants to better retain new knowledge after the course. Although novices had significantly toward pre-test score than experts in upper GI endoscopy, then they improved significantly more over the course, and there was no difference in post-test score between the groups. This curriculum was useful in closing the training gap between observation and human procedure, as well as reducing learning curve in operating room. Post-course survey showed more than half of participants had performed or were planning to perform the procedure after completing the course. Thank you for attention.
Thank you. Question from the floor?
Hi, Shanley Deal from Virginia Mason. Excellent presentation. I was just curious, for those who did not complete a procedure or plan to complete a procedure within the year following the course, do you recommend that they repeat the course before they plan to do their first procedure? And were there any reasons why maybe they weren't planning to do that, any particular barriers at their institution?
There's many experienced variety experienced participants composed this participant.
Yeah, I think I would never have been able to give a presentation in Japanese, so I'm gonna help Dr. Kishiki out here because he's done great work with this in our lab. And I think that what was interesting is a lot of the people that came that wound up not doing poem, the course was actually helpful for them to understand that. I think some people came with skill sets that they realized maybe were a little bit less than what is necessary to really perform it safely. So we did have the group that didn't perform poem actually wound up actually referring a lot to some of the instructors and so forth because they realized that this is probably not for them. So it's a good question.
I have a more philosophical question. Great presentation. This is great data. And the question is, should we be teaching poem massively now, even though we don't have good data to show that it is the right operation? That's number one question. Number two question is, if a surgeon, 40% of the surgeons did only 5 cases a year, should they be performing poem? Mm-hmm. That's, coming from Pellegrini program where, you need to do 30, 40 a year to really be good at doing achalaisias. Should we guarantee that someone's going to do at least 15 or 20? I mean, just a philosophy. I'm not questioning, just a...
Right. Well, I mean, that data of the 5.5 that's how many they did within the first year of the course. Maybe they're doing 20 the next year, I don't know. But you're right. I mean, I think it's similar to the laparoscopic myotomy paradigm where probably achalasia or motor diseases in general of the esophagus should be at centers that are doing it frequently. As you know, there's ample data out there about experience and patients do better. So I think you are right in that. I would also say, though, that I do think that the courses are helpful because I think that we also want to make sure that people are doing it right. So I think if we, if people are not learning it correctly and trying it, clinically without good education, then we might actually see a procedure that still has potential, not used well in the future.
I have one more question. It wasn't presented, but I guess that there were no complications on those.
Yeah, we didn't
points.
ask in the survey about complications. You mean during the simulation course or when they went back home?
When they went to practice.
Yeah, we didn't ask that question in the survey. That might be something that we could do in the future.
To look in the future.
Yeah.
Awesome.
Yeah.
Thank you very much.